Coming up on 7:45 on your Friday, artificial intelligence is moving quickly into everything. But today we're talking about healthcare in Houston. The Texas Medical Center will host an AI summit next month. We're exploring how this technology can be turned into real-world solutions. Joining us to talk about AI and automation, expert Dr. Patrick Dix, once again helping us understand what this means for those in the field, but also for patients. All right, thanks for being here. We could have you on so regularly and have so many new things to say. Well, I mean, just today, quickly before we get to the interview, I'm looking at this new app and the way that it can transform my pictures into these Norman Rockwell-style paintings. I just can't believe what AI can do. So let's talk about the impact in healthcare right now. What can you tell us?
Well, in healthcare right now, you have artificial intelligence that can help with medical research, it can help with vaccine development, and it can also help predict future diseases. As of right now, we have the bad flu season going around. You have artificial intelligence that can use predictability analysis once researchers load pre-existing data into some large language models and can predict to say, hey, 5 years down the line, there will be another bad flu season. This is how we can prepare people for it.
All right. So what about the patient? How is AI changing the patient experience?
More customized options for people that speak different languages. Let's say you live in the South where we're at. The way that the AI can be tailored to you can be different. If you live over in California, it could be different. If you live in the North, it can be different. And also if you live down in Florida. Also for people that speak different languages. Before we would have to have somebody right there that could translate or be a translator. Now you have artificial intelligence that can do it for you. I'm not saying it's going to always be correct, but it can get 80% of the job done to where somebody that actually speaks that language could come in and finish up the conversation to help the patients out.
Okay, tell us about this next one. This is interesting. AI scientists using AI to design entirely new viruses that may bypass existing safety checks. So why is this a concern? Why are they doing this? What do we know about this?
This is a very, very major concern. What I want people to understand is someone with little or no experience with artificial intelligence can create a biomedical weapon that can spread throughout the world. Now, we have to think about in other countries, they don't have any rules or regulations on how they run AI. Over here in America, at least people are trying to come together to say, hey, we don't want it used for this or used for that. But you have adversaries that can get hold of artificial intelligence to say, I want to create a biological weapon to destroy the United States. Or you may have somebody here to say, I don't really know how to do medical research, but artificial intelligence can help me create this and spread it to masses of people.
Okay, wow, never heard that one. Let's talk about a story that we did earlier this week about Grok being integrated into the U.S. military. That Pete Hegseth announced that just days ago. What does that look like? What are the pros and cons, we could say, when deploying AI like this in the way that whatever we know so far about Grok being used in the U.S. military?
Well, with the U.S. military, you want to stay ahead of your adversaries. And with artificial intelligence, with them implementing Grok, they have the capabilities to do that now, working along with soldiers and military personnel. One of the biggest things I want people to understand, we talked about artificial intelligence as a tool. Now it's collaborating with humans. We're not just going to set this language and forget about it. And when, we're talking about national defense, it can collaborate with the soldiers to say, hey, have you thought about this scenario of how an adversary could attack us? Have you thought about this training? We could put the missile systems and we could put also the defense systems to say artificial intelligence is saying this is where the next missile is coming from. This is where the next breach is coming from. And also, I am going to pull up, my drone right here. This is a perfect example. This is my personal DJI drone. This is why you need artificial intelligence, because overseas and in other countries, this is where technology is leading us to. And this is how warfare is being done with these kamikaze drones. And also, we're using it for other things to get into networks and spread misinformation as well.
Dr. Patrick Dix, thank you so much for joining us this morning.
Thank you.
Time now is 7:49.